Welcome, everyone. So very, very excited to have you all joining us for our Lunch and Learn series today. And we are especially so grateful because we have Jim Morton and Anne Pirie, and they are going to be doing an introduction to Bowen family systems theory, which is also a taster for a special fall seminar that we are offering. Again, this is the second time that they are doing this, and they are offering this out of the generosity of their heart and spirit. So we are so grateful and indebted to them for helping to build up the skills and knowledge and understanding of our members. Specifically, Bowen family systems theory is such a foundational concept. It was one of the first things that I studied when I first began my own learning. And I'm so excited that so many of us are going to have a chance to learn more about it. So deep, deep gratitude to them both and to all of you for joining us. You can put questions in the chat and or in the Q&A, and we will have a moment for that at the end, as well as during. But first, I want to invite everyone to use the chat and acknowledge the name of where you are located. So if you go to the bottom right, you'll see placenames.mapdev.ca, or you can also do it via Google. I would like to begin by acknowledging that I am speaking from Unama'ki. This is located on the ancestral and unceded territory of the Mi'kmaq, whose inherent rights were recognized in the peace and friendship treaties that were signed with the Mi'kmaq, Maliseet, and Passamaquoddy peoples from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act in 1982, and they remain active to this day. Let us take this time to pause in reflection and gratitude for the land where we live and work. The Nova Scotia College of Social Workers commits to translating this acknowledgement into action. By seeking to implement the recommendations of the Truth and Reconciliation Commission's calls to action, especially those regarding education, we commit to doing what we can to becoming better treaty partners. We commit to learning and to unlearning. Let us take this moment to pause in gratitude for all who have and continue to heroically care and advocate for this beautiful land. May we join them in this sacred work. Let us ground ourselves in the wisdom of the land-based Mi'kmaq teachings and values that we must all begin to learn. Let us work to decolonize ourselves, our practice, and this community that we share by working for justice for all living beings as an expression of our gratitude for being here. Let us take a deep breath and recenter ourselves away from the violent ways colonization fills our world and fills us. Let us take a deep breath and work on letting go of the unconscious bias that is everywhere, inside and out. May our session today lead us to be in right relationship with this land and with one another. And when we acknowledge the land, we must also begin to acknowledge the wisdom of this planet and align ourselves with its truths. And this thumbprint, fingerprint, and tree stump is a reminder of the deep interconnected ways that we are all in relationship with one another, and how in the same way as we see this parallel in patterns, I'm excited about the learning we're going to do today about all of the other patterns that we share. So with that, I'm going to stop screen share, and I am going to invite Jim and Anne to help us continue our session. And thank you all so very much.
Thank you, Anne, and welcome to everyone. Anne, I appreciate that robust acknowledgement and the call to live in right relationship with people and the land and the earth. And I see people are signing in from different parts of Mi'kmaq and across the land, and so welcome. I really appreciate this opportunity to to offer this introduction and to work with the Nova Scotia College. You've been very supportive. We're really pleased to be here today. And so Jim and I will introduce ourselves, and I invite you to continue over this lunch hour to put your names in the chat and to use that with various reflections and questions. I'm Anne Pirie, and I live in Sackville, New Brunswick, a border community with Nova Scotia on Wabanaki territory. At the risk of using a phrase that sounds like an acuity test, I'm a daughter, a sister, a mother, a colleague, and grandmother, all of which occur in relationship. I'm a retired clinical social worker, member of the New Brunswick Association of Social Workers. I graduated with an MSW in 1973 from Carleton, and I've practiced in a variety of settings in 5 different provinces, which has been a real opportunity in hospitals and treatment centers, family service, private practice, and mental health clinic. But before that, I grew up as a middle child of 4 siblings. And for me, that was an experience of being a participant observer in a large extended family who lived nearby. So when I was introduced to family therapy, I was really keen about learning and drawn to learn more. And initially that involved the work of Jay Haley and Virginia Satir, narrative and structural approaches, including reflecting teams. In the 1990s, I learned about Bowen family systems theory from Jim Morton when we were in practice together. It made a lot of sense to me and offered a clear theoretical framework. And now I find that it also informs my perspective as a grandmother. So Jim, tell us about you. I invite you to introduce yourself.
Thank you, Anne, and good afternoon, everybody, and thanks for being with us. My name is Jim Morton. I'm joining you from the Annapolis Valley in the place that the Mi'kmaq call Pinoak, and it's a cloudy, drizzly day here now. I've been practicing social work since 1975, and the focus of my practice has essentially been clinical work, although I've approached that from quite a few different angles. I've worked in mental health and addictions. I've worked in a family service agency. I've been part of an acute care hospital social work team. I've done consulting and teaching and administration as a social worker. And I became interested in family therapy very early on in my practice. In fact, I got an MSW from Dalhousie, which offered no program, no educational program on family work, and discovered that the Atlantic School of Theology was offering a course in family therapy, and we organized a social work activity with the School of Theology that was kind of my introduction to the work. But later, maybe after a decade or so of using, maybe even more than that, of using family therapy as a model for practice, I decided to look at Bowen family systems theory for historical reasons, because it showed up in the literature quite a bit. And what I discovered actually opened a whole new window of understanding of the world for me, and it changed the nature of how I thought about my work, not only as a family therapist, but as a social worker, as a citizen, as a family member, as a person in the world. And so I'm excited to be here today to be part of a discussion of this. And if I can just maybe say a couple of more things, which I think fit into, as we're co-facilitating this, into my part of the presentation, we want to tell you this morning a little bit about Bowen family systems theory. We're going to introduce the postgraduate program that will be starting in just a little less than a month from now. And we hope that you'll have a chance to raise some questions and give us some feedback about what you're thinking before the end of this hour.
Thanks, Jim. It is good to be here. And I see that people are coming in from all over Turtle Island, across Canada and other countries. And I know life is busy, and this lunch hour time will go quickly. And Jim, you'll be clarifying some of the things that we're going to be covering during this time.
Yes. So I think we're seeing the PowerPoint now. I think you were going to mention a couple of things about the mobile.
Yes. Okay. So having a look at this, you'll see before you a mobile, which is a nice example of a closed system. The parts move whenever there's a movement or energy, and that affects the entire system. So but it doesn't change the mass of it. The movement in one part does not change the mass of the whole structure. It's a nice example of a closed system. And Jim, I know you're going to tell us about the nature of open systems and the origins of Bowen family systems.
Yes, well, I'll say a little bit more about open systems as we move to the next slide, but I do want to say a couple of words about the name Bowen family systems theory. Bowen, just so you're up to speed from the beginning, Bowen refers to Murray Bowen, a psychiatrist whose life spanned a good part of the 20th century, and was discovered his thinking about families and systems largely at the midpoint of the 20th century, when he was doing research with schizophrenic patients and their families who were all admitted to an inpatient unit at the National Research Institute in Bethesda, Maryland. Family refers to not, sometimes we think about family as a nuclear family. Maybe that's the popular definition of family. But in Bowen terms, family refers to a multi-generational extended family. A huge expanding network of people related by genetic experience and by social experience. One definition of a system, and one that I think is maybe helpful, is a complex of elements standing in interaction. The mobile is an example of standing in interaction. No matter how much it moves, it continues to find its own pattern. Bowen thought that systems were rooted in evolution in the natural world. So N's picture of a thumbprint and a tree print, as you'll see, resonates with us too. And theory refers to what Bowen and his colleagues came up with, a set of ideas and 8 specific concepts in the early days that attempt to describe human behavior. And so we're going to move, I think, at this point to the next slide, and you're going to see something that might look here.
Thank you. So we're shifting a bit here. What you see before you is a comic strip, Herman, by Jim Unger, who was a prolific Canadian cartoonist. So what I'm going to invite, I'll read through this and just follow along with me. So we join Ralph, who's on a phone call. Is that Alex Wilson, who used to live on Pinewood Crescent? Is that you, Alex? This is your brother Ralphie. That's right, Ralph. Yeah, I know, 30 years is a long time, but I've been busy. How are Doreen and the kids? Yeah, well, you said some things too, but that's a long time ago. Blood's thicker than water, Alex. Listen, have you still got 2 kidneys? So you could see, just imagine if I'd read this script with no picture. So what we know is that context is important. And as social workers, we know about the significance of context. And Jim, you're going to look further at context with us as we move.
Yeah, well, like Jim Unger, Bowen family systems theory links symptoms to context, and it assumes that the family is a system. In Bowen theory, we often refer to the family as an emotional unit, that's the nature of this system. And lots to learn about emotion in this theory too. And this conversation from that we just looked at with Ralph and his brother in a distant place is launched from a hospital bed. But Bowen family systems theory applies to many different settings. It does have application in healthcare, in mental health and addictions, in religious organizations, in the workplace, in all workplaces, but you can imagine one of the particular ones that matter where this fits a great deal is family-owned businesses, in child protection, in schools and in governance. And as Anne so well pointed out when she was introducing herself, it also applies to our lives as family members. So everybody, we think, can find relevance in this theory in terms of thinking. And we're influenced, we think, by context all the time. Context involves relationships, and it involves time, multiple generations of time, not just the current moment, but the past, and also our expectations of the future. And the family, as Anne also was pointing out earlier, is unlike a mobile in that it's an open system. An open system is able to adopt new information, and families are in a constant state of flux because of new information that it's exposed to. That information may have to do with things like technology, or with pets or neighbors, or moves from one place to another, by births and deaths, by health and illness. So many things might, or maybe even by a new idea. So all kinds of context can influence family life. So now we're going to move the slide again, and you'll see an image.
So looking at this image, just take a moment to consider it. What might be happening here? And you can just pop your thoughts in the chat. Any family picture, family gathering, number of thoughts about that.
Sounds like everybody's getting already getting the idea here.
Yeah, I guess so, eh? So let's move to...
Everybody's begun to wonder about context.
I guess so.
Yep.
So I'm seeing what the participants are seeing, and the chat, and that's my limitation here. But let's move to the next slide. There's shading around the edges, and now we can see more around the edges. Now, take a moment just to consider this. What might be happening here? And again, I invite you to note your thoughts in the chat.
We see a family picture on a vacation, a reunion, a family photo session.
Yeah.
Family reunion in a park.
Yeah.
A family.
And that's it. Family picture, family day, celebration. So you can see from their faces, we get more detail about what's going on and who's there.
Yeah.
Well, we could have leaped to a number of conclusions about the first picture. We could have talked about him being depressed and those kind of things.
Alvin says, if I could mention this, that once a person is put into a family, our perspective about them changes.
Yes, it does indeed. And in this particular family, we had limited detail before, and as you've noted, our perspective changes when there are more details about the context in this larger image. This is, in fact, a photo of Anita Amand, who is the third from the left in the second row, or the second from the left in the second row. And here she is with her parents and extended family. And she's in Kentville, Nova Scotia, where she grew up. Anita is now the president of the National Treasury Board in Canada. And this is a photo from Maclean's magazine.
All right, so we want to move to the next slide. And I guess what we want to say about this slide is that we've been showing you the photos that we have because Bowen family systems theory asserts an important assumption. That's what this quotation is about. How one family member is adapting to life's challenges cannot be adequately understood separate from that individual's relationship with other family members. So the emphasis here is on cannot be adequately understood. And if you can't let go of kind of causal or linear thinking, it becomes difficult to think from a systems perspective and difficult to understand maybe what Bowen theory is getting at. It requires a shift in ways we think about theory. So we're going to show you another quotation.
So we see that shift in the natural world as well. This is a quote from Suzanne Simard, who is a professor of forestry and conservation at UBC in BC. Trees are the foundation of a forest, but a forest is much more than what you see. Underground, there is this world of infinite biological pathways that connect trees and allow them to communicate. The great thing about forests is that as complex systems, they have an enormous capacity to self-heal. And in this time, following the heels of forest fires, may it be so. It's really important to note the forests are like human families in that they are built on relationships which form networks. And Suzanne Simard had written The Mother Tree, which talks about the interconnection of the system and likens it here to human families built on relationships. And we're going to now move to looking more at family systems and discussing family relationships. So shifting away here from natural systems to more complex systems.
Back one more slide. Yeah, thank you, Anne. Oops, that's it. Great. So what you're seeing here in this slide is a kind of note that I may have scratched on when I was contacted by the mother of a young person. And the square at the top is part it's a way of, the square is a way of illustrating a male person. And the double square suggests the person who's the focus of attention. In this case, we know it's somebody who's about a male person who's about 14 years old. And we know that because of the B09. This young person was born in 2009. And the reason that I had this conversation with the mother is that she called looking for some help for her son because the school had been complaining about his behavior. The school said he was aggressive, that he was resisting instruction and direction. They were more concerned about this than they might usually have been because he's much bigger than his peers. But the fact is that he was also expressing aggressive behavior at home. But the family found ways to tolerate that until the school pushed them to take some action. So as I've given you this bit of information, I want to ask you, as we did with the photo before, what do you think could be happening with this young person? And what thoughts do you have about his condition and about about what might be done to help him? So what do you think? Just jot whatever thoughts occur to you in the chat.
So a change in the home environment and bullying behavior. Struggling with learning strategies, underlying anxiety, maybe trauma and a broken home. Maybe he's being bullied at school, abuse, a comment, ask him, adolescence, maybe struggling with learning difficulties and high anxiety. And comment, judgmental attitude, like to assess more, wondering what's going on at home. At this point, merely guesswork, too little information.
Absolutely, and I think that's true. There is too little information here, and yet, you know, my observation about the clinical world that we live in, and maybe lots of other related worlds that we live in, is that we focus almost always on the individual, and often we don't seek additional information other than what the individual is able to provide us with. And I think that's a tremendous handicap. So let's look at the next slide. It perhaps looks a little bit familiar. You'll see in the lower left-hand corner that the slide you saw previously suggests that this 14-year-old, if that's what he is at this moment, is related to a larger world. This is an example of a 3-generational family diagram. And you'll see in this picture a set of squares and circles. And then in this family, everybody identifies as either male or female. But you'll see that this young fellow is the eldest of 3 children. He has a younger brother who was born about a year after him, a little more than a year after him, and a younger sister who was born in 2013. One of the things we learn when we look at this diagram is that his younger brother was born with a heart defect. And that heart defect meant that he's had multiple surgeries and spent a great deal of time in hospital especially in the early part of his life. Mother feels particularly close to this middle child as well as to her younger daughter, and we can tell that by those 3 red lines shown in that way suggest a kind of maybe even an over closeness between the individuals. But we also see that the mother has a more distant and conflicted relationship shown by that jagged line, the jagged angled line, and the single line that runs through it. We know as well that the parents have been together they've been married actually. We don't know if they were together before they were married, but they've been married since 2007. And we can tell that by the notation that's made here, and the line that connects the father on the left and the mother on the right is often referred to as the marriage line or the cohabitation line. We can see that there's a half-filled section of the father's square, which suggests he has an addiction problem. In his case, he uses alcohol in ways that are problematic, which is something we've begun to learn through the exploration process. We've also learned that mother has worked as a homemaker for a number of years, but had a career prior to her children's birth as a lab tech, something she thinks about returning to but hasn't. Mother was born in 1985 and father in 1981. We'll see. You can see here as well that father is the middle of 3 sons, but there's a broken line between a line with 2 lines with gaps that connect father with his father and his mother, which suggests, in using Bowen theory language, that he's cut off from his parents. He has no contact with them. He doesn't talk with them. And if he does run into them or is forced to have contact with them, it's perfunctory. Mother, on the other hand, has quite a bit of contact with her parents, but we know that her relationship with her mother is tense. She tends to avoid sharing information with her mother. Feels like she gets too much advice from her mother and has many disagreements. Again, that distance and experience of tension is shown by the jagged line. So now we know quite a bit more about this young fellow than we knew in the first slide. And given what you've seen here, what thoughts emerge now about the presenting problem? What are you thinking about at this point? Just jot whatever thoughts occur to you in the chat. What thoughts emerge about the presenting problem? How would you describe the presenting problem now? Seeing attachment issues is one thing.
Attention seeking. Relationship with parents might be an issue. Question about addiction and lack of control over his environment and abandonment. Hasn't learned family relationships from his parents. Complex relational dynamics between generations. feeling detached, attention-seeking, comments on relational dynamics. Everything impacts everything else. Difficulty finding place, wondering what the parents' relationship is like.
I think, one of the things, and we'll move along, but one of the things that emerges as you're describing the situation now is that there are a complex of possibilities in terms of what might be considered important. It increases not only the amount of information, but the options for intervening. So we're going to move a little further discussion.
So it's remarkable how a diagram with shapes and colors can give highlight a lot of information. And family diagrams were initiated by Dr. Murray Bowen. This is a photo of Dr. Bowen looking like a good coach with chalk in hand and a family diagram on the board. Of course, that speaks to an earlier technology. But just as Jim has shown us, it's very helpful to use a pen or a pencil and a piece of paper to begin fleshing out a family diagram. Bowen himself trained in the as a psychiatrist in a psychoanalytic model. And during his work with patients who had schizophrenia, he began to notice the influence of other family members on their functioning. And at that time, whole families were sometimes in residence with the patient, so he could observe them and talk with them. So, but rather than developing a theory of pathology, Bowen focused on common patterns in all families, and he developed the concepts of family systems. He also worked on applying his learning in dealing with crisis in his own family and encouraged clinicians to also work on their position in their own families. So we're going to shift now to look at a video from the Bowen Center for Family Systems. It gives an overview of the 8 concepts of Bowen Family Systems Theory and how they're applied. And as you're watching, I invite you to, following that, just note what stands out for you after in the chat. So we'll watch this. Thanks.
Welcome to a brief overview of Bowen Family Systems Theory, as presented by the Bowen Center for the Study of the Family and by Goldberg and Goldberg's book, Family Therapy and Overview. Bowen Family Systems Theory is a theory of human behavior that views the family as an emotional unit and uses systems thinking to describe the complex interactions in this unit. It is the nature of a family that its members are intensely connected emotionally. Families so profoundly affect their members' thoughts, feelings, and actions that it often seems as if people are living under the same emotional skin. People solicit each other's attention, approval, and support, and react to each other's needs, expectations, and upsets. Connectedness and reactivity make the functioning of family members interdependent. A change in one person's functioning is predictably followed by reciprocal changes in the functioning of others. The emotional interdependence presumably evolved to promote the cohesiveness and cooperation families require to protect, shelter, and feed their members. Heightened tension, however, can intensify these processes that promote unity and teamwork, and this can lead to problems. When family members get anxious, the anxiety can escalate by spreading infectiously among them. As anxiety goes up, the emotional connectedness of the family members become more stressful than comforting. The individual who does the most accommodating literally absorbs system anxiety, and thus is the family member most vulnerable to problems such as depression, alcoholism, affairs, or physical illness. The emotional system affects most human activity and is the principal driving force in the development of clinical problems. Knowledge of how the emotional system operates in one's family, work, and social systems reveals new and more effective options for solving problems in each of these areas. The 8 core concepts of Bowen Family Systems Theory are emotional triangles, differentiation of self, nuclear family systems, family projective process, multi-generational transmission process, emotional cutoff, sibling position, and societal emotional process. A triangle is a three-person relationship system. It is considered the building block of larger emotional systems because the triangle is the smallest stable relationship system. A two-person system is unstable because it tolerates little tension before involving a third person. A triangle can contain much more tension without involving another person because the tension can shift around three relationships. If the tension is too high for one triangle to contain, it spreads to a series of interlocking triangles. Spreading the tension can stabilize the system, but nothing gets resolved. The patterns in a triangle change with increasing tension. In calm periods, two people are comfortably close insiders, and a third person is an uncomfortable outsider. The insiders actively exclude the outsider, and the outsider works to get closer to one of them. Someone is always uncomfortable in a triangle and pushing for change. Differentiation of self. The basic building blocks of the self are inborn, but an individual's family relationships during childhood and adolescence primarily determine how much self they develop. Once established, the level of self rarely changes unless a person makes a structured and long-term effort to change. People with a poorly differentiated self depend so heavily on the acceptance and approval of others that they quickly adjust to what they think, say, and do to please others, or they dogmatically proclaim what others should be like and pressure them to conform. The concept of the nuclear family emotional system describes four basic relationship patterns that govern where problems develop in the family. People's attitudes and beliefs about relationships play a role in the patterns, but the forces primarily driving them are part of the emotional system. The four basic relationship patterns are marital conflict, dysfunction in one spouse, impairment of one or more children, and emotional distance. The family projection process describes the primary way parents transmit their emotional problems to a child. The projection process can impair the functioning of one or more children and increase their vulnerability to clinical symptoms. Children then inherit many types of problems as well as strengths through the relationships with their parents. The problems children inherit that most affect their lives are relationship sensitivities, such as heightened need for attention and approval, difficulty dealing with expectations, the tendency to blame oneself or others, and feeling responsible for the happiness of others or that others are responsible for their own happiness. The concept of the multi-generational transmission process describes how small differences in the levels of differentiation between parents and their offspring lead over many generations to marked differences in differentiation among the members of the multi-generational family. The information creating these differences is transmitted across generations through relationships. The transmission occurs on several interconnected levels, ranging from the conscious teaching and learning of information to automatic and unconscious programming of emotional reactions and behaviors. The concept of emotional cutoff describes people managing their unresolved emotional issues with parents, siblings, and other family members by reducing or totally cutting off emotional contact with them. Emotional contact can be reduced by people moving away from their families and rarely going home, or it can be reduced by people staying in physical contact with their families but avoiding sensitive issues. Relationships may look better if people cut off to manage them, but the problems are dormant and unresolved. People who grow up in the same sibling position predictably have important common characteristics. The characteristics of one position are not better than those of another, but rather are complementary. Each concept in Bowen theory applies to non-family groups such as work and social organizations. The concept of societal emotional process describes how the emotional system governs behavior on a societal level, promoting both progressive and regressive periods in society. Goals of treatment include understanding the family emotional system, observing and recognizing family patterns, reducing anxiety and relieving symptoms, restoring trust and fairness, increasing differentiation, and demonstrating intergenerational patterns. Some interventions include teaching differentiation, focusing on thinking more than feeling, detriangulating by reducing dyadic interactions, encouraging I statements, reopening cutoff relations, and guiding families to identify triggers for reactivity. That's the end of our brief overview for Bowen Family Systems Therapy. Thanks for watching.
Okay.
Welcome
thanks.
to a brief overview of Bowen.
Just take a minute. And I invite you just to jot some of your thoughts and reflections. What stands out from watching that video? That was dense. Unfortunately, someone was knocked off. Any thoughts about watching that? What you noticed? What stands out? Earlier, someone had commented that everything impacts everything else, and certainly this is an example of how things are intertwined and interact. The emotional unit, the connectivity of it all. Interesting about family position, firstborn, middle, giving a window on the world. Very interesting, interested in the constant fluidity of the emotional relations within family. Well, thank you for your comments.
I think that reference to fluidity is an important term, because it's I mean, it was as one looks at the actions in any human system, it is in a kind of constant motion, like a river. You can dip a bucket in a stream at any point multiple times a day, and it'll always be something different. That's what families are like. One of the things that always stands out for me when I see that video is that connection between the family as an emotional unit, sort of thinking about the family as a group, a cohesive group, and also the an equal emphasis, in a sense, on the differentiation of self. So there's a kind of tension between the individual and the group in Bowen systems theory, which is a subject of a great deal of attention in this work.
I'm always struck by how this is Bowen family systems theory, and in particular in this video, it's not a description of pathology, but of processes that are common in all human families. And so let's just, this is the quote from the paragraph from the first of the video. As you look at this slide, Bowen family systems theory is a theory about human behavior that views the family as an emotional unit and uses systems thinking to describe the complex interaction in this unit. And we know that family refers to an evolving multi-generational system that's really closely tied to societal systems within which the family exists. And so now we move to a different diagram, and Jim is going to use the next series of diagrams to illustrate movement from linear thinking to systems thinking.
What we've been talking about in lots of ways, and in the little bit of time we have, it's difficult to grasp all this, I'm sure, for people who aren't familiar with systems thinking. But there is this need to move from causal thinking or cause and effect thinking to systems thinking. The figure on the left is maybe an example of linear thinking or linear causation. So as an example, if A might involve adverse childhood experience, we might assume that adverse childhood experience may show up as behavioral problems in school, which might lead to having difficulty with work, finding work, or in the workplace, which might lead to poverty. That way of thinking about things is a kind of linear causation, that one thing leads to another. A more complex way of thinking about causation is in the middle diagram, which has been labeled as multiple causation. In that situation, again, if we use an example, we might think about A being adverse childhood experience, and maybe B being inconsistent parenting, and C, a low income. D might be being bullied at school. And if there was an E, perhaps it could, or an F, let's say, perhaps it could be an exposure to alcohol. We might say that those combination of things led to addiction. And that's, again, another way of thinking about causation as something that's related to cause and effect. Systems thinking is of a different order. So in this diagram, you can see that there are arrows moving in multiple directions and involving several players, in this case 5, but the number of players can expand considerably. If I can use an example again, if we look at B and A, let's imagine that B has been criticizing A for something that they've done. And A has handled that by doing their best to get away from B's criticism. And the result of that is that B is just escalated, criticized more. And at some point in that process, E, who's kind of sensitive to these things, says, I think you're being too tough on A. And B says to E to stay out of it. And in that part of as that's unfolding, A turns to C and maybe says something, can you tell me why B won't get off my case? I don't understand it. And looks to C for some comfort. So you can see that there's a kind of reciprocity that occurs in a system that means that information and people bounce ideas and communication off each other, and their experience becomes not so much one of cause and effect, but one of transaction and of continuous, unending transaction. So systems thinking is, I would say, reciprocal, not causal. And I guess we wanted to emphasize this again because Bowen systems theory does make this particular demand of us. It asks us to replace cause and effect with systems thinking. And I think I'd like to underline the word replace. It's not to complement or to use sometimes, but to actually change our way of thinking about the nature of human behavior as something that's systemic and not causal.
Jim, there are a couple of comments in the chat. I wonder if you would comment on. One is around how does this theory understand the therapist becoming part of the system they enter to intervene?
I think that's a really important question because the family is an open system. The therapist, and in Bowen theory, the therapist is often referred to as a coach, obviously brings an element of change immediately into the system. In Bowen theory, there's in clinical practice or in work with any system, the effort is to sort of have one foot in the system and one foot out, to have a way of being connected, yet but remaining on the periphery. And the stance of the work is to be as a research stance, to attempt to understand and to learn about the system as a way of bringing change to it. The coach doesn't have much to offer in terms of goals or direction, but does have a way of helping people think about the nature of their relationships, to help them see them more by helping people learn a little bit more about the theory and then understand and then observing their own behavior and practice.
Thank you. So you've talked about the effect of the therapist as a punctuating element of the system in a particular way, as being curious and clear and both outside and comment, helping the members of the system learn about themselves.
Heather mentions that the sound, I'm interpreting this a little bit, but sounds strengths-based, and I think that's probably an accurate way to to think about this. It may also be weakness-based because, you know, the person who shows up for help is usually the one who's struggling the most. But in this kind of work, and we don't have time to talk about this today, but the notion of of differentiation of self is that those individuals with the most differentiation of self are in the best position to provide leadership. And often this work is about finding those individuals or that individual within the system who have the most capacity to provide leadership through taking charge of their own lives and their own behaviors.
That's a really helpful comment, Jim. In the early days, the intention was to bring whole families together as a way to get them interacting and to reevaluate relationships and the way they interacted. And that's not the case with this. It isn't necessary to bring a whole family together. I think what you're suggesting is it's important to work with the person who has a fair degree of self-differentiation, and whoever comes. Those are the people that we need to be able to welcome and work with.
Yeah, if I could just add two thoughts to what you stimulated me to say. One is I think there is value in seeing whole families, particularly early on, so you can as a way of observing what we're talking about, and to make, because I think some things can be learned and some things can be taught. Bowen family systems theory needs to be learned. I don't think anybody can teach it. Not really. It's something you have to figure out for yourself. And a coach can kind of guide some of the process, but seeing whole families together is like being in a laboratory where you get to observe the lives of others directly. But it's equally true that seeing one individual, if it's somebody who has the capacity to make change, will have an effect on everyone else. That's what systems thinking is about. I've long learned in the world of addiction that I'd much rather work with a better differentiated spouse than I would with someone who's caught up in the throes of the addiction. If I had to choose who to work with, it would not be with the addicted person, but somebody who's closely connected with them and plans to stick around.
And you know, Murray Bowen often commented that we as therapists also benefit in being clearer in our work by working on our own families and our position in those, so that we're both observing and leading and learning.
I think we need to move to the next slide just in terms of time.
So we need to clarify what this postgraduate program, what to expect. So just looking at what
I was going to say, the first thing we expect is that it's going to be 8 2.5-hour weekly seminars.
And in that, we'll investigate the foundations and concepts of Bowen family systems theory. We'll meet on Thursdays, October the 12th to November the 30th from 6 to 8:30 p.m.
One of the things that's worth thinking about in this is that this program involves 20 professional development hours as defined by the Nova Scotia College of Social Workers. So that 20 hours would allow someone to gather all of the formal professional development hours they need to re-register or to register.
So the class size is limited to 12 participants, and we would be keeping a waiting list.
And unlike some of the other programs like this one today, there is a cost to the 8 sessions, which the college has set at somewhere around $50. I think on the website it says $49.26, which helps recover the cost of a text book that is used in the program and the cost of mailing and so on to get that material in the hands of people.
Okay, thank you.
And we're really pleased as we're moving along to be offering one of the many, just be among many of the fine programs that are offered by the College of Social Workers in Nova Scotia and CASW nationally.
And I'm going to just interrupt to say we are actually all full. So we advertise this. This is why we want to encourage everyone to quickly look at your newsletter. This class filled up like 5 seconds after we posted it. But this is the second year that Anne and Jim have volunteered to do this on a voluntary basis. And we are going to be also having an additional different course on a different topic in the winter. And if other people are interested in volunteering to teach or share or learn, this is the kind of ongoing learning we're excited to continue to offer. So this is more like letting you know, maybe you want to start watching for a future learning opportunity, but we have already filled our slots for this year.
I guess I would suggest if somebody's interested, well, still make your effort to register, and if people drop out in the nature.
Last year we had a couple of people who dropped out at the last minute for a variety of reasons. So by all means, please continue to reach out to myself and or Suzanne, and of course also Jim.
So there is a request for the text that's going to be used, and let's talk about that now. It's the 8 Concepts of Bowen Family Systems Theory by Roberta Gilbert.
It looks like that.
Excellent.
So what I guess if we could go back just to say a word about what the program looks like before we end. As we've mentioned, it's 8 interactive participatory programs. This is there will be a lot of discussion in this program, and the participation will provide leadership from facilitators and from those people who are registered in the program.
And there'll be limited assigned readings about Bowen Family Systems Theory from the chapters of the book, along with a plethora of other materials that will be available through a link, both videos and articles. So we'll be investigating the foundations and concepts of Bowen Family Systems Theory.
And participants can expect to make brief presentations in a secure small group setting. In lots of ways, this is like a tutorial. Everyone will be presenting through during the course of the 8 weeks, and everybody will be part of the conversation.
So we'll be practicing developing and using family diagrams of each of our own families, and we'll demonstrate how to create by presenting our own family diagrams, Jim and I.
And we've spaced this learning at weekly intervals, so as a way of providing opportunities to learn, to kind of test out what one's learning within the context of one's family, maybe in one's own workplace, or in community groups that people are involved in.
We're hoping that this learning will reinforce taking a research position, both in our own families and our work, that learning about systems leads to asking questions, and we see this as valuable for all of us in our world. And
I think it's telling us we're about out of time.
Yeah, so we are so excited. So this program's already, there's no link to register because we have already filled those slots, but you can certainly let us know if you are interested in being on a waiting list. And I think we already have a pretty good waiting list, which just speaks to the desire for learning around family systems theory, which also that systems approach is what guides our social justice advocacy work as well, recognizing that we are all part of larger wholes. So grateful to Anne and Jim both for sharing and introducing us, especially for those people who didn't know much about Bowen or family systems theory. It's such an important way to be a social worker that aligns so perfectly with our values, and we are so grateful to everyone. So if ever you have any questions, NSCSW at nssw.org is the best way to reach out to us, and always check our YouTube video. And again, Jim and Anne, thank you so very much for today, and we look forward to being able to have ongoing learning with you all. Thank you.
Thank you, Anne, and to the college. And please leave a comment if we've stirred anything up or you have questions or comments. And you should feel free to email Jim or myself. I think are those available, those emails?
If what we will do is we will, please reach out to NSCSW at nscsw.org and we will do our best to reply, or you can put it in the chat. So thank you, everyone. And thank you
Thanks
to
very
those of
much.
us joining
Thanks,
online.
everyone. Good to see you all.
Thank you.